29.
Just reminding members, please switch off all mobile phones and Blackberries because they will interfere with the recording. Just want to advise members that there's a new agenda in the tabled papers, and these are just to accommodate 3 statutory rules in relation to the Health and Social Care Pension Scheme. So are members content to consider those after agenda item 6?
Great.
Item 1 then is apologies.
George Robinson.
Any other apologies? Okay, thank you. Item 2 under Chair's business, just reminding the committee that we're co-hosting an event with the Education Committee this evening in the Long Gallery at 6:30. It's a stakeholder event to discuss the provision of health services in support of access to the school curriculum. I know members are busy, but asking you if at all possible to consider attending the event this evening. Also under Chair's business, a number of items just that are pertinent currently. Firstly, the Minister had announced in question time during the week that he is due to bring forward guidelines on termination of pregnancy. He'd indicated that this would be done within the next few weeks. I'm seeking agreement that we would seek clarification on that in terms of timescales. Certainly it was very specific in terms of a number of weeks, so I would appreciate member support to get that clarification from the department on that.
Great.
Also, there was an issue last week in relation to the budgetary evidence session. The question around the additional 200 million that was allocated to health seemed to have decreased to in and around 150 million. It wasn't clear from the department's response, in my view, how that had been reached, or indeed where the 49 or 50 million had been allocated towards. It wasn't clear in the department's response to the committee. So I'm seeking clarification or support to seek that clarification from the Minister and the department in relation to 200 million and now the figure of 150 million.
Great.
Thank you. Just also reminding members that several committee members will be taking part on the visit to Scotland next week, which is from the 24th to the 26th of March. Those members that have indicated that they will be attending will be receiving an information pack with an itinerary for the visit and information that may be useful whilst on the visit. Committee staff will be sending an electronic copy to members later this week, and then will be delivering a hard copy to members early next week. Okay. Item 3, members, is the draft minutes of Wednesday the 11th of March 2015, which are at page 6. Are members content with the minutes?
Great.
And item 4 is the Food Hygiene Rating Bill, the informal clause by clause scrutiny. Just want to refer members to the clerk's paper at page 11, which summarises the discussions we've had on each of the clauses to date, and an updated list of proposed amendments from the Food Standards Agency, which is at page 16. The indication from members last week was that as a committee we were content with the majority of what the FSA is proposing, and there were just a few issues that we needed to iron out. As agreed at last week's meeting, the clerk has sought legal advice in relation to the website issue, and we will receive that legal advice and consider that issue further at our meeting on the 15th of April. So since our meeting last week, the FSA has again written to the committee on this issue, which is at page 4 of your tabled papers. They're suggesting a further amendment to clause 14, suggesting we can consider this suggestion further in light of the discussions we have on the same issue on the 15th of April. The purpose of the meeting today, therefore, is for the committee to consider each clause and ascertain whether we need any further information on it before we do our formal clause-by-clause reading at our meeting on the 22nd of April. I would emphasise that we're not taking any formal decisions today. So I'm now going to take each clause in turn. Officials are in the gallery and they're available to come to the table if required on any clause. So clause 1, members, there was a number of technical issues were raised in relation to clause 1 around the definition of an inspection. We also discussed the fact that the bill does not cover business-to-business supply of food. However, clause 1(7) allows that to be changed if necessary and at a later date. The FSA is not proposing any amendments to Clause 1. Are members content to move on to the next clause?
Agreed.
2. The FSA is proposing a number of amendments to Clause 2, which deals with the notification and publication of a rating. There will be an amendment to allow councils to provide some information at an earlier date than the notification of a rating. However, all information is still required to be provided within 14 days. There will be an amendment to introduce a timescale of 34 days within which councils must inform the FSA of a rating, and a timescale of 7 days after the end of the appeal period in which the FSA must publish the rating online. An amendment is also proposed to define the end of the appeal period. The FSA is proposing an amendment in relation to the regulations, which will be required regarding the format of the sticker. This will allow for the potential of there being different types of stickers, such as those with council branding, and to specify who will pay for the different types of stickers. Are members content to move on to the next clause? Clause 3, the FSA is proposing an amendment which requires a council to inform the FSA of the outcome of an appeal, or if the appeal has been abandoned. If the rating has changed as a result of the appeal, the FSA must publish the new rating within 7 days online. The amendment is consistent with that to Clause 2.5, Part 5. We had discussions in relation to the proposal from the pubs of Ulster, who were in favour of the bill being amended to allow for a period of grace in which businesses would be allowed time after an inspection to fix issues without their rating being downgraded. We had a lengthy discussion with the FSA on the matter. Their position was that a grace period would be a radical change to the scheme and would undermine one of the key purposes, which is to encourage self-compliance by businesses. They also pointed out that the bill already contains a right to re-rating in Clause 4. The period in which a re-rating can be requested has been reduced from 6 to 3 months to recognise the right of businesses to make fairly swift improvements in order to achieve a higher rating. So given those reasons, members had indicated last week that they were content with the FSA position. Are members then content to move on to the next clause?
Great.
I think that's a fairly good compromise.
Okay, thank you. Clause 4, members, the FSA again proposing an amendment to require a council to notify the FSA of the outcome of re-rating within 34 days. It will also require the FSA to publish the new rating online within 7 days of the end of the appeal period, and this mirrors again the arrangements in Clause 2. An amendment is also proposed to allow the Department, through subordinate legislation, to limit the number of occasions on which a business can request a re-rating. This amendment is a consequence of the FSA's decision to remove Clause 14, Part 8, which the committee believed gave the FSA too wide-ranging powers to be able to change the Act after review. This amendment to Clause 4, in terms of the number of re-ratings, is much more limited in its nature. So therefore, are members content to move on to the next clause?
Great.
Clause 5, members, the FSA again proposing a number of amendments to Clause 5, which deal with the right of reply. The FSA is proposing an amendment to specify a time period of 21 days in which Council must deal with the right to reply. The FSA is also proposing an amendment to specify a time period of 7 days in which it must publish a right of reply online. There is also an amendment to link the publication of the right of reply to the publication of the rating to which it refers. Committee members had been concerned about the Council's power to edit representations or choose not to send them to the FSA, and the fact that the FSA would have no way of knowing this. However, we have been advised by the FSA that there will be guidance accompanying the bill for councils on the reasons for editing or refusing to send representations. As with the other operation of other parts of the scheme, there has to be an assumption that councils will carry out their responsibilities, obviously in a professional manner and in line with law and guidance. The FSA also have the power to audit how councils are operating the scheme. Given those reasons, members had indicated last week that they were content with the FSA position. Are members therefore content to move to the next clause?
Agree.
Clause 6, members, again, FSA proposing a technical amendment to remove clause 6, part 4. Are members content to move to the next clause?
Agreed.
Clause 7, the FSA is not proposing any amendments to clause 7. However, members are concerned that the bill does not require businesses to display their rating on their website. If orders for food are placed directly through the website, the committee has sought legal advice in this matter, and as I said earlier, we will discuss this further on receipt of the legal advice on the 15th of April. Are members therefore content to move to the next clause at this stage? Clauses 8 to 11. The FSA is not proposing any amendments to clauses 8 to clauses 11. Are members content to move to clause 12? Clause 12, the FSA has proposed an amendment to clause 12 to allow councils the flexibility to provide information to businesses at different stages of the registration process. Are members content to move to the next clause?
Agreed.
Clause 13, FSA not proposing any amendments to clause 13. Are members content to move to the next? Clause 14, the FSA is proposing a number of amendments to clause 14, which deals with the review of the Act. The amendments take on board the committee's and the examiner of statutory rules concerns that the clause as drafted is too wide-ranging. The FSA is going to remove clause 14 part 8. The FSA is also proposing an amendment to clause 14 to require them to promote the scheme. For example, they have acknowledged that they could do more to publicise the fact that all the ratings are available on their website for consumers' information. As a committee, while the amendment doesn't deal with our concerns regarding the website issue, I don't think that we would have any objection to it being part of the bill. Are members content, therefore, to move to the next clause? The FSA is proposing a further amendment to clause 14 in the letter dated the 16th of March, which is at page 4 of your tabled papers. Again, this is in relation to the website issue. But as I mentioned earlier, I think it would make sense for the committee to consider this proposed amendment at our meeting on the 15th of April when we have received the legal advice. Clauses 15, there are no amendments proposed. Are members content to move to the next clause? A new clause, adjustment of time periods. The new clause will allow the Department to amend the time periods specified in the Act by substituting a different time period. For example, the 14 days in which the Council must notify a business of its rating could be changed through subordinate legislation. This power can be exercised at any time and not just as a result of carrying out a formal review of the Act, which is consistent with other clauses. The new clause will also allow councils and the FSA itself flexibility around meeting various timescales in the Act because of Christmas closure of council or FSA premises and because of exceptional circumstances. The guidance accompanying the bill will clarify what constitutes exceptional circumstances, and the FSA has the power to audit how councils apply the exceptional circumstances rule. In light of this explanation, members had indicated last week that they were content now with the FSA position. Are members content to move to the next clause? Clause 16, the FSA is proposing a technical amendment to clause 16. Are members therefore content to move on? And clause 17, there are no amendments proposed. Are members content to move on? Clause 18, the FSA is proposing an amendment in relation to powers around limiting the number of re-rating through subordinate legislation. This reflects again the amendment made to clause 4. So are members content to move on? Clauses 19 and 20, there are no amendments proposed. Are members content to move on? The schedule, there are no amendments proposed. Are members content to move on? Are there any further issues that members want to raise at this point? Okay, just to advise members then that at the next meeting on the 15th of April, we'll be considering the legal advice in relation to the website issue. We will then move to the formal clause-by-clause reading of the bill on the 22nd of April, when we will, and I'll be stressing, taking formal decisions on each of the clauses at that point. Thank you. Okay, members, item 5 is an SR, the Firefighters Pension Scheme Regulations 2015, page 22 of your meeting pack for the relevant papers. Reminding members that we had considered and approved the SL1 at our meeting on the 28th of January 2015. There's been no changes to the policy content since the SL1 was submitted to the committee, and the examiner of statutory rules has nothing to report on the SR, which is subject to negative resolution. Are members content? If so, the Committee for Health, Social Services and Public Safety has considered the Firefighters Pension Scheme Regulations 2015 and has no objection to the rule. Item 6 is another SR, the Health Services Cross-Border Healthcare Amendment Regulations 2015, which is page 30 of your meeting pack. Again, reminding members that the committee considered and approved the SL1 for the rule at our meeting on the 4th of March 2015. No changes to the policy content, and the examiner of statutory rules has nothing to report on the SR, which is subject to negative resolution. Are members content? Therefore, the Committee for Health, Social Services and Public Safety has considered the Health Services Cross-Border Healthcare Regulations and has no objection to the rule. 13 is an SR, the Health and Social Care Pension Scheme Regulations, page 13 of your tabled pack. Reminding members that the committee considered and approved this SL1 for the rule at our meeting on the 4th of March 2015. No changes to policy content, and the examiner of statutory rules has not yet reported on the SR, which is subject to negative resolution. Are members content with the statutory rule?
Chair, can I just declare an interest on item 13, 14 and 15?
Thank you. Therefore, the Committee for Health, Social Services and Public Safety has considered the Health and Social Care Pension Scheme Regulations, and subject to the examiner of statutory rules report, has no objection to the rule. 14 is another SR, Health and Personal Social Services, Additional Voluntary Contributions and Injury Benefits, Health and Social Care Pension Scheme Regulations 2015. And it's page 21 of the tabled pack. Again, we had considered and approved the SL1 for this rule at our meeting on the 4th of March 2015. No changes to policy content, and the examiner of statutory rules has not yet reported on the SR, which is subject to negative resolution. Are members content with the statutory rule? Therefore, the Committee for Health, Social Services and Public Safety has considered the Health and Personal Social Services Superannuation Scheme Additional Voluntary Contributions and Injury Benefits, Health and Social Care Pension Scheme Regulations 2015, and subject to the examiner of statutory rules report, has no objection to the rule. 15 is a Health and Social Care Pension Scheme Transitional and Consequential Provisions Regulations 2015, page 29 of the table pack. Again, reminding members we had considered and approved this SL1 on the 4th of March. There's been no changes to policy content, and the examiner of statutory rules has not yet reported. Are members content with the statutory rule?
Right.
Therefore, the Committee for Health, Social Services and Public Safety has considered the Health and Social Care Pension Scheme Transitional and Consequential Provisions Regulations, and subject to the examiner of statutory rules report, has no objection to the rule. Another SL1, the Health and Social Care Disciplinary Procedures Regulations 2015, which is page 42 of the meeting pack. The proposed rule will amend certain presentational errors and concerns raised over the continuance of the 1996 appeals process, which were highlighted by the examiner of the statutory rules. Are members content that the department makes the statutory rule? Item 8 is a forward work programme, asking members to note. Item 9 is matters arising. There are 2 items under matters arising in the meeting folder and 3 in your tabled pack. In the interest of time, I want to draw attention to a number of them. Item 9.1 on page 49 is correspondence from the Minister regarding the commissioning plan direction. Following the evidence session from the committee, the Minister has now revised the direction in a number of areas. A new target, thankfully, has now been included around substance misuse which I suppose it goes without saying why it didn't appear the first time around. However, it is now included, and that's to be welcomed, and I think acknowledged a good piece of work from the committee. Page 69 is correspondence from the Minister regarding an update on the committee's recommendations on the health inequalities report. Just advising members that one of the issues that the committee will be discussing with the community health groups during our visit to Scotland will be health inequalities and preventative spend. So it may be useful to refer to this update during our visit to inform discussions. Also within the report, and bear with me, I'm just trying to bring it up here, there was specific reference to the ministerial, page 71 I'm looking for, a ministerial group on public health. Seeking agreement here, members, that we write to the department to get clarity on the terms of reference for the group and how wider sectors can participate and feed in to this debate. It's a ministerial committee for public health. Okay, yes, and there was the clerks just reminding me. Another point which is on page 59, one of the issues in the budgetary session last week was the reference to the difference between statutory and discretionary spend, and the definition that we've been given here doesn't seem to address the issue in proper clarity, in my view. So I'm seeking agreement that we go back to the department to give us an absolute definition in writing of what statutory and discretionary spend is.
Great.
Okay. Members, in your tabled packs, 9.5 is correspondence from Adoption UK regarding an update on adoption legislation. I'm just reminding members that the committee had received a response from the Minister on this issue on the 2nd of February, and he had stated that he intended to write to the Executive to seek agreement to proceed on the public consultation on the draft Adoption and Children's Bill. The timetable of the legislation will then depend on the outcome of the Executive's consideration, but I'm asking for members' agreement that we would write to the Minister again for a timeline and update on the issue.
Great.
Great.
Item 10 is correspondence. There are 8 items of correspondence. Again, just want to draw your attention to several of them. Items 10.2 to 10.5 on pages 85 to 88 are correspondence from the Human Rights Commission, the Commissioner for Children and Young People, Age Sector Platform, Dr. Tony Damaglu, is it Damaglu? Did I pronounce that right? And Safe Food, all requesting meetings with the committee. Suggesting, members, that we invite the organisation to the committee's next stakeholder event on the 20th of May.
Great.
Sorry, can I just bring it on page 85 from the Human Rights Commission? They came in front of DSD committee a couple of weeks ago. So they did to do with carers, and it was to do with the fund from DSD committee, but most of it was health committee. I think it's very interesting. I would encourage, it would be better if all members could hear that rather than us splitting up into groups of where we're failing a lot of our carers. It was quite a powerful presentation from some people that were present who were carers.
Okay.
So I don't know if we can have them in actually as a witness session rather than a, but I think it would be important for everybody to hear that one.
Okay, well, could I suggest maybe that, because I was going to suggest also in terms of, given the fact there's a new appointment for the Commissioner for Children and Young People, that maybe the Chair and Deputy Chair met with those 2 organisations separately, and then if we needed to feed a wider session, we can do that. Members are in agreement with that?
Agreed.
Okay, item 10.8 on page 92 is correspondence from a Mr. and Mrs. Bovard regarding their son. I'm asking members if they're content to advise the family to contact their local representatives for support. Item 11 is any other business. Members have. And item 12 is the next committee meeting will be on Wednesday the 15th of April, starting at 2 p.m. on the Senate chamber.
Committee room